Personal protective equipment. Personal protective equipment are used to protect the skin and mucous membranes of healthcare workers from exposure to blood and or body fluids and from the healthcare worker to the patient during sterile and invasive procedures. They are specialized clothing or equipment which are worn against the infectious material. The main objective of these personal protective equipment are to protect the healthcare worker, and second is protection of the patient. So the selection of the appropriate PPE is based on the level of risk associated with contamination of skin, mucous membranes, and clothing by blood and body fluids during a specific patient care activity or intervention or as a part of standard precaution. And it is also based on the route of transmission of suspected organisms, which can be either by contact, droplet, and inhalation, or as a part of transmission based precaution. It is also based on the durability of the PPE and how it is fitting while wearing. The various personal protective equipment which are used in the healthcare settings are gloves, as you can see, mask, uh, face shield, shoe cover, goggles, and head cover. Gloves. The gloves are used as a part of standard contact and uh, droplet precautions. It can protect both patients and healthcare workers from exposure to microorganisms that have colonized their hands. It is a The gloves should be worn only when there is an indication. The use of gloves in situations where when their use is not indicated represents a waste of resources and gives a false sense of security. So when should be the gloves worn? It should be worn before a sterile procedure when there is an anticipation of a contact with blood or body fluids regardless of the existence of sterile conditions and including contact with non-intact skin and mucous membrane, and in cases of contact with the patient during contact precautions. The indications for gloves removal are as soon as the gloves are damaged, after contact with blood or body fluid or non-contact skin and mucous membrane, after contact with the patient and their surroundings as a contaminated body site, and when there is an indication for hand hygiene. So this is the picture which shows the donning and doffing of the glove. So the various types of gloves according to the use with clinical situation. Non-sterile gloves, the indication of use is potential for exposure to body fluids, blood secretions, or excretions, contact with non-intact skin or mucous membrane. The examples include venipuncture, vaginal examination, emptying of a urinary catheter bag, nasogastric aspiration. Sterile gloves is used wherever there is a sterile environment is required. For example, urinary catheter site dressing, then central venous line insertion dressing, lumbar puncture, clinical care of surgical wounds or drainage sites, and reusable utility gloves where it is used in non-patient care activities. For example, handling or cleaning contaminated equipment or surfaces, housekeeping duties, instrumental cleaning in CSSD unit. The types of gloves according to the physical material and their features. First is the latex rubber gloves. It can be nitrile gloves, vinyl gloves, and rubber gloves. Next PPE is respiratory protections, that is using of face masks and respirators. It reduces the risk of contamination of droplets. There are two types of respiratory protection can be provided, that is the face masks and the respirator. Face masks can be of two types. First is the surgical mask, which is fluid resistant, and second is the isolation or procedure masks, which are not fluid resistant. Surgical masks, uh, they are also called three-ply masks and are loose-fitting, single-use item that cover the nose and the mouth. Surgical mask should be discharged, discarded, or changed after 4 to 6 hours of use. It should never be reapplied after removal. Masks should not be left dangling around the neck, which is a common practice observed among the healthcare workers. Touching the front of the mask while wearing should be avoided. Mask should not be worn with beard or unshaven face, and perform hand hygiene before wearing the mask. So these are the do's and don'ts for the face mask. When putting on the mask, you should always clean your hands and put on your mask so it fully covers your mouth and nose. When wearing a mask, do not dangle this mask. You can see, as you can see here, it should be on the nose. And when removing a mask, clean your hands and remove your face, touching only the straps or ties. Respirator, they protect the wearer from inhaling particulate matter, including airborne microorganisms, fumes, vapors, and gases. There are two categories of respirators. That one is the air purifying respirator, other is the air supplied respirator. The most common respirator used in the hospital setting is the N95 respirator. N95 refers to non-resistance to oil and ability to filter off 95% of the airborne particles. The composition of N95 respirator is comprised of 4 layers of material: an outer and inner layer of spun bond polypropylene, and two middle layers of cellulose or polyester and melt blown polypropylene filter. Negative pressure in the N95 mask uh, are maintained because the pressure inside the face piece is negative during inhalation compared to the pressure outside the respirator. The N95 mask should be removed or changed once in 8 hours or earlier if it gets clogged, wet, or dirty on the inside, or deformed or torn. N95 respirators is used only for single use and should not be used as it cannot be cleaned or disinfected. Fit checking is a must. After wearing the N95 mask respirator, the healthcare workers must perform a fit check to ensure if it is fit properly. No clinical activity should be undertaken until a satisfactory fit check has been achieved. So the how to check the fit check, it includes the following steps. That is, first you have to check whether it is sealed. The respirator is compressed to ensure a seal across the face, cheeks, and the nasal bridge, and it should be a positive pressure seal, or it can be checked by gentle exhaling, and a negative pressure seal of the respirator is checked by gently inhaling. Fit testing is done to identify which size and style of N95 mask is suitable for an individual, and to train the healthcare workers on how to don and doff the N95 respirator. It should be done at the time of joining and thereafter annually. So there are various types of respirators. The being the most common being the N95. According to the oil resistance property, not oil resistance are N95, N99, and N100. Oil resistance are uh, R95, R99, R100, and oil proof that is strongly resistant to oil are P95, P99, and P100. So N95 is the most common mask respirator used, and we need to have a fit check. This is the technique of donning of a respirator. First, you should separate the two headbands. Then hold the headbands while you cup the respirator to your face. Pull the headbands over your head. Position the lower headband at the base of your neck. The higher headband should go around the crown. Next, press firmly on both sides of the nosepiece to create a secure, comfortable fit. If necessary, make minor adjustment until the respirator feels secure. Properly don N95 respirator. So as you can see, the fit checking, it ensures the respirator is sealed over the bridge of the nose and mouth. The procedure is placement, then sealing, then positive pressure seal, and then the negative pressure seal is checked. Next comes the aprons and gowns. It is required during contact precautions and during sterile aseptic procedures. These all come under the protective body clothing. Uh, the laboratory coats, they are used as a part of standard precaution by all laboratory staff, which protect their clothing and skin from the splash of blood or body fluid. However, they are not fluid resistant. Plastic aprons worn when there is a low risk of contamination of blood or body fluid. They are fluid resistant and for single use only, that is used for one procedure or one patient care activity. Disposable gowns, they are long sleeved, fluid resistance indicated when there is a moderate risk of contamination with blood or body fluids. There is a cover all, which is it includes a gown with a pant and hood which covers the whole body including the head. Coverall should be used in the following situation: when there is anticipated risk of splashing with a large volume of blood or body fluid, anticipated risk of extensive skin to skin contact with a patient known to harbor organisms of contact transmission, and handling patients infected with pathogens of higher mortality or in the laboratory while handling their specimens. For example, Nipah or Ebola virus. So aprons are recommended for general use when possibility of spray or spill is present. After task must be removed immediately by wearing the neck strap and waist tie and gently rolling it inwards to minimize the contamination. There are full coverage gowns as explained. It consists of a gown, a pant and a hood which covers the whole body, and as you can see how to don and how to doff the gown. So the types of apron and gown along with the intended uses. Plastic apron, it is a disposable and fluid resistance apron which is single use. It is used only when there is risk of exposure to body or blood body fluids. And in cases of contact precautions, gowns are also single use and disposable. It prevents from splashing or spray of blood or body fluids. Full body gown with their fluid resistance and single use. They are long sleeved, prevents healthcare workers from skin contact with patient skin, minimize the risk of exposure to large amounts of body substances, and sterile gown. It is used for procedures requiring aseptic. Next comes the protective eye or face wear. Protective eye wears, goggles or facials are used to protect the mucous membrane of the eyes, nose, and mouth. It prevents exposure to blood or body fluids that may be splashed, sprayed, or splattered into the face during clinical procedures. Eyewear must be worn during procedures that are likely to generate droplets of aerosols or blood and or out of high risk body fluids. Next is the we were again doffing of. So first putting on, that is donning of PPE. First includes the first you should put the gown first. Next the mask or respirator. Then next the goggles or face shield, and next extend to the covered wrist uh, of isolation gown, that is the gloves. The doffing of the PPE includes first the gloves. The outside of the gloves are contaminated, so if you have to put your hands get in the get in during the glove removal, immediately wash your hands or use an alcohol hand based sanitizer. Using a gloved hand, grasp the uh, palm area of the other hand and peel off the first glove. Then hold hold removed glove in gloved hand. Use the side fingers of the ungloved hand under remaining of the glove at wrist and peel off the second glove over the first one. Discard gloves in the waste container. Next you should remove is the goggles or the face shield. Next is the gown, and next the mask respirator. Wash or use an alcohol based hand sanitizer immediately after removing all the PPEs. So where should we remove the PP? It should be at the doorway before leaving patient room or in the patient room. Remove respirator outside the room after door has been closed. Removable air should not be used for any other purpose. Inspection of the personal protective equipment is a mandate, and any visible contamination should be removed with a disinfectant wipe before disposal. Ensure that the hand hygiene practices are available at the point needed. Example, a sink or alcohol based hand rub. Shower with soap and water and wash. Disposal of PP in the red bin. You need to dispose the gloves, the goggles, the face shield, the plastic ape. In the yellow, you have to dispose the mask, the respirators, the shoe covers, and the gowns. The